Let's get on then to talking a bit about anatomy in a rather gruesome picture to start with. When I've done this lecture now for a few years, but a couple of years ago I came across this notion of plastination for preserving bodies. As you can see, it kind of covers them in a coat of basically plastic, bodies that have been skinned and flayed. There's no smell and no decay, and that was suggested as a kind of teaching tool, as a sort of compromise for anatomy teaching between having a kind of real dead body, or a bit of a dead body, as it were, in front of you, and doing it all on a computer-generated thing on the computer. But interestingly enough, and this is a bit of going back to the past, these plastinated bodies turned out to be used much more for what you might call entertainment. Not really for medical students or for actual medical teaching at all. In fact, it was really, as I've said here, theatre. So it's somebody's real body, but it's covered in this stuff. You can see the expression of the woman there looking at it, plainly unimpressed. And there was actually a bloke, I think a Dutchman, who took a lot of these specimens round entertainment venues as a kind of entertainment. And people would go, oh, how could you possibly do that? Horrible, horrible. But in fact, it's only going back to what anatomy was back in the past, which we're going to look at now. There was an element of theatre to it. There's also an element of teaching and research, of course, but you've got to remember there's always the two. And there's also the question, of course, would you donate your body if it was needed for anatomy, for teaching? We tend to think in the past, weren't these people silly, as we'll see, who didn't want to donate bodies for this kind of thing? But would we really want to, if we knew we were going to be kind of exhibited in front of people? Tricky. Okay, so just reminding you from last week, remember I had this rather gruesome picture, which was in fact Alexandrian anatomy, Alexandria in North Africa. If you wanted to be a good student, you wanted to get a good CV, you went to somewhere like Alexandria where they actually did anatomies, but they only had about one body a year. So your chances of actually getting a hands-on experience was not very likely. So what did they do if they didn't have human beings? Well, they got animals. And if you remember, we said some of the animals that were used were apes, because they look superficially like human beings, pigs, because counterintuitively their internal organs are rather similar to human beings, and any other animals that you could possibly get your hands on. No problems about ethics committees, nobody worried about what happened to animals, so you could basically cut them up to your heart's content. So when university medical faculties were started, remember I talked about that around about the 11th or 12th century, they were started very much on the basis of using anatomy as the center of medical education. Why? Could have been other things, but they didn't. They used anatomy. And it was because of this bloke that we talked about last week, Galen. Because he'd written so much about his experiences with anatomy, albeit with animals mainly, not with humans, here was a body of literature that was just sitting there waiting to be used by the students. How appealing was that? You all like stuff that you get given to you, as it were, that you can get the information from. Galen was a bit like the original version of looking on the internet for something. You want to know something? Look in Galen. So almost because he'd written so much, accidentally, his writings became the center of this new kind of medical education at the new universities. However, little problem. We would assume these days that any medical surgical text would have pictures. You'd think, well, diagrams, pictures, obviously. Did older works have pictures? On the whole, they didn't. Mainly, if there were illustrations, they tended to be text from the East rather than the West. They went in for illustrations a lot more. Western texts, not so much. But you can see what illustrations there were, quite frankly, weren't very helpful. I mean, here's a bloke. You can see it's supposed to be a kind of well, I don't know if you'd call it a picture or a diagram of his internal organs. Plainly, they're really nothing like that. So there's a lot more imagination gone into this than actually looking at what they look like. Moreover, this one, which is a little bit later on, his are all kind of bundled up in the middle here too. So the idea was you didn't really need illustrations in a book. That seems completely counterintuitive to us. We think, of course you'd need illustrations. Well, here's a good example if we need to get into their way of thinking. Why didn't... Oh, were we keeping you? Okay. All right. Strange. Maybe he doesn't like bodies. Okay, you'd think, yes, pictures. But to a Western university way of thinking, you didn't need pictures. Pictures were like the equivalent of having a comic book version of what you were doing. An intelligent person can read the prose and can get out of that. It's not our way of thinking, of course it's not. But it was the way they thought then. This is about to change, as we'll see, with particularly one person. In the meantime, she just noticed that anatomy is gathering strength. Western universities are doing this a lot. Now here's one at Montpellier in the south of France in the 15th century, 1400s. You can see the bloke who's doing the cutting up here. He's got a rather alarmingly large knife. So you get the impression he's not going to do very delicate work here somehow or other. There's another few tools down here that look pretty scary. So they're obviously going to have a real go at the body here. I'm not sure what this person's holding the box for. It may be for internal organs to go in. That's a possibility. But you can see all the people who are watching. They're all male, of course. Oh, no, here's a couple of women down here. The male ones would be members of the faculty, the teachers. They've got the long robe. That tells you that's an educated lecturer, as it were. And they're cutting up the body. But quite frankly, they're not really going to see a lot. Why is that? We'll see in a minute. Here's a very, very, very famous illustration. If you look online, you'll see endless reproductions of this particular illustration in different versions of it. This is a black and white one. Sometimes you see them in color. It's so well known, but it's often actually read by us slightly wrongly. Supposedly, it's an anatomy lesson. But there have been questions about who that actually is up here. He looks a bit young to be a professor, although there were some fairly young professors in those days, as we'll see. He could have been one of the students who was set up there to read. So he's up there reading. And what's he reading? He's reading from the works of Galen about anatomy. And that's the center of these students' course. Some people down here may be students. It's a little hard to tell. Are there other problems? Yes, there certainly are. Who's this bloke down here with his, again, you probably can't see it very well, a really, really very large knife? He's not one of the students, nor is he one of the university faculty. He would be somebody like the local butcher, or perhaps the person who castrated animals. Why? Because he worked with his hands and he knew about bodies. Why weren't the learned professors and the students doing it? Because they worked with their brains, not hands-on stuff. Hands-on stuff was for artisans and peasants. So they got somebody else to do the cutting up for them. But of course, he hasn't the faintest idea what he's doing. So they're not really going to get a very good result from this one. Other problems? Yes. The main one was that there were really very, very few bodies available to do this kind of thing with. Nowadays, we get we don't get no bodies. Even nowadays, people aren't terribly keen to donate for this kind of thing. But then there were definite religious taboos against this kind of thing. There were also social taboos. I mean, it seems fair enough, doesn't it? You don't want your relative to end up on a kind of trestle table in front of a whole gaggle of students being cut up. But the main taboo against this against donating your body for this kind of thing was that the bodies they did use were executed criminals. So the criminal who'd been put to death for murdering somebody or something like that, he had no choice over what happened to his body. Neither did his family. Families couldn't claim bodies in those days because he'd gone against the law of the land. He had no rights left. So the executed criminals were used. So if you donated your body, you were putting yourself in the position of an executed criminal, according to popular thought. Not a good one. It had another effect, just before we move on. Note the body here, who hasn't quite been cut up yet. Nearly all of these bodies were male bodies. Not many women were executed in those days. There's always less women than men. And it was mainly men. Sad to say, if women were executed, they tended to be put to death for being a witch. We'll talk about that in a later lecture. And if you were put to death for being a witch, you were burnt at the stake. So plainly, no body left. So they were mainly male. And that's not a small point, as we'll see when it came to studying anatomy, the fact you had a male body rather than a female one. The other problem was that these bodies had often lain around for quite a while, so unfortunately they were already decaying before they started the procedure of cutting them up. And as I've already said, very inexpert dissection. So while this picture might be put up online, for example, as a picture of a dissection in a university medieval faculty, they were pretty inefficient situations, really, and not a lot of people learned an awful lot from it, to be perfectly honest. Okay, change is in the air. Always important. Why do changes take place? Same as nowadays. Why do we get change in medicine and healthcare? It has to be something pushing it. And in this case, although there were other factors, as we'll see, there was certainly one man who was very, very much in the forefront of change. His name was Andreas Vesalius. That's the Latin version of his name, notice. Vesalius, I-U-S at the end, always means his name has been Latinized. You can see his dates there, so we're in the 16th century. Why was his name in Latin? Because he didn't speak Latin necessarily in everyday life, because Latin and Greek were the languages of university life. Remember last week we said you had to know classical languages. If you were all doing medicine at university 100 years ago, you would have all had to know Latin and Greek. Well, it wasn't actually necessary by then, but you were still supposed to know it to get in. So, the anatomy lesson. Vesalius starts a different kind of anatomy lesson. Who is he? Well, I suppose we'd call him these days, he was kind of the rock star professor. He was very young, even for those days, when people tended to get their positions younger. He was international. He'd come from Brussels, which nowadays is in Belgium, and he'd come to the best university in Western Europe, Padua. So he really was the rock star of professors at this time. And he was the one students wanted to go to. And of course, he wrote the book. This is how you maintain your fame. And of course, it's in Latin, because that's the language of the intelligentsia and the universities. In Latin, it's called De Humani Corporis Fabrica, which translates into about the workings of the human body. And in fact, there's a copy of it in the library here, a great big one, like a copy of the original one, if you ever feel you want to have a look at it. Published in 1543, which is such a seminal date that in history it's kind of like an anniversary for medicine. People say before 1543, after 50, a bit like the First World War or something like that. It's a real watershed date because of this bloke. Here's a picture of him. We can read this picture. He's young. May not look that young to you, but he is fairly young in this picture. He's looking directly at I was going to say at the camera, obviously not the camera, looking directly at the artist, which is always a sign in pictures that you're confident. Look at any pictures. If you see somebody looking away in early pictures, that's meant to show they're a bit underhand and a bit dubious. So he's confident, he's looking straight at the camera, at the artist. And look at what he's doing. He's doing something. He's not sat up on a chair telling other people what to do. He's actually holding a dissected arm and doing his own dissection. Down here, you probably can't see it very well. Down here is what he's writing about on the bit of paper, the parchment, and there's his ink and his inkwell and his pen. So this is a set-up picture, obviously. He probably didn't look nearly as smart as this when he was actually doing it. But he's dissecting and he's writing about it. So he's writing about first-hand experience. He's been so disgusted with the inefficient dissections that have gone on that he wants to take a hold of this and do it properly. So that's it. And he writes about it in his book. Here's another couple of pictures from his book, famous frontispiece of the book showing him doing a dissection down here, and this is the blow-up version of it. A bit gruesome, but still. Slightly out of proportion, some of this picture. He's got a very big head for some unknown reason. I'm not quite sure why. As you can see, this blow-up version is a slightly different one. He looks different in this one from that one. There's endless copies of these pictures, so you don't always get them exactly the same. You can see very, very crowded sort of amphitheater where he's doing his dissection, and that would be accurate because people came from all over the world, really, to watch him doing his dissections. This bloke down here, I don't know if you can see it very well in this picture, who's turning away like that, is supposed to be one of the older professors who's not very pleased. Because here's the new young professor who's coming up with all these new ideas, which I'll tell you about in a minute. And it's undermining the old stuff. He's not happy. Down here, the blow-up version, very unusual. It's actually a woman he's dissecting, not a man. And that's deliberate, because he's saying, quite accurately, all the anatomies we've got so far are on men. And plainly, men's bodies are different from female bodies. So if we're wanting to use this for the basis of treatment, we need female bodies and male bodies, hence the female one here. OK, moving on. He got his book illustrated. This is mainly why it's famous. It's the first properly illustrated anatomy textbook. And he doesn't just do it himself, because obviously he's not an artist. He gets a Renaissance artist. That means Renaissance in Europe means that bodies were being depicted realistically. Not like these funny old things we saw before, but actually as they looked. You can see this is a very realistic skeleton here that Van Kalkar drew. Not completely accurate from our point of view, but not bad. But notice he's put him in a kind of human position, almost as if he's thinking. And this is meant to explain that this was a real person. All right, a skeleton now, but nevertheless, at one stage, a real person. And here's the body that's been flayed so that you can see what's underneath the skin and the muscles, and so and the pelvic bones. It's very detailed. So students can actually use this, not just look at it and admire it. It's actually to be used. However, here's where time and place matters, and it still does these days. If it hadn't been for the printing press in this period, his book would never have been as famous as it is now. Printing press is invented in the 15th century, so about 100 years before. It was as big a revolution as all the IT revolution is today. Being able to print books was just as big a change as you all having your laptops and your phones and things these days. It was a quick change, too, exactly like the IT stuff. It happened in a very short space of time. Handwriting became old-fashioned, slow. Nobody does that anymore. Anyone who was on the cutting edge of technology had their stuff printed by the printing press. And here's a printed version of Vesalius's book. It was a bestseller because you could print so many copies. Not just that, but it became a status symbol as well. It was a symbol of being up with the new information. You needed to know the new stuff, even if you weren't doing medicine. It was still new information. It showed you were intelligent. So if you had a study in your house, you might have a lectern. That's just a thing you put the big books on if they're too heavy to hold, a bit like coffee table books these days. And you'd have it up there so that when your friends came to visit, you could say, they could look and they would think, they've got they've got that one, right? They know what they're talking about. Interesting. I didn't think they were so intelligent, but obviously they are. Even if you'd never read it. I mean, it's like so many books these days, people have them, they never actually read them. But it looks good, so it looks very good. And cleverly, Vesalius was a great marketer. He insisted on there being a cheap edition for students. And in fact, we still have some of these editions that belong to students in the 16th century where they have their notes in the margin. So it's a real going back into the past if you see that kind of thing. So this is the first time. It's like getting stuff on your laptop, up on Moodle. For the first time, students were getting stuff in a little package that they could actually use. They put it in their back pocket, take it out when they went to one of Vesalius's lectures, make notes in the margin. This was real revolutionary stuff. So very clever marketing. So please notice you can write the best book in the world, but if you don't have all of this infrastructure, it simply doesn't become so famous. Okay, moving on very quickly. The influence of this book. It made anatomy literally the center of medical education. But notice who for? For physicians. They were actually very unlikely ever to be doing anything with this anatomy. But it's what you did. And here's a picture of anatomy theatre, one of the ones I think you can still see in Padua or Verona, one of the Italian cities. Notice what it's called. It's called an anatomy theatre. Here's where we come back to this notion of display and theatre. People could sit round here, mainly students, of course, but members of the public could come in as well and watch anatomies being done on the table here. So because it was physicians, we have to say, how useful actually was this? Was there an element of theatre in it? Well, yes, there was. It did something, though, that we're still familiar with today. It changed the notion of the human body. The Hippocratic version, remember we talked about that a couple of weeks ago, it was a very organic view of the body, like the body in tune with nature. This one, this anatomy point of view, saw the body as a collection of parts that worked together. And when it didn't work, if one bit didn't work, then the rest of it probably didn't work either. So it's very much a sort of mechanical view of the body, rather than an organic view. And we'll talk more about that in the next lecture. But it shifts the idea. So the notion of being in tune with nature, not quite so common. More people, incidentally, were also living in towns and cities, and so we're losing touch with nature a bit anyway. So weren't so familiar with that idea. And finally, on this one, it made absolutely no difference to patients. None whatsoever. It was all theoretical at this stage, really. Knowing what the inside of a body did or didn't look like, quite frankly, as far as treating the patients was concerned, was no help at all. Even if it was reasonably accurate, it told you nothing about how you could treat the body or how you could cure it. That's not going to come, believe it or not, for about 300 years. A bit depressing in a way. So, if you were a patient in the 17th century, who did you go to? You didn't go to one of these physicians who'd been trained on the anatomy in the universities. Why didn't you? Because there weren't very many of them, for a start. They were mainly in the cities, and probably you couldn't afford them. They were expensive. So who did you go to? What if you weren't feeling very well? Well, you could go to an apothecary. That's just the old word for what we would call a pharmacist today. So you'd go along to the pharmacist's shop. Here's the shop. Somebody doing something with their mortar and pestle. And you'd explain what your symptoms were, and you'd ask them to give you some medicine. Not unlike we can do today, really. So was this a good idea? Well, sometimes it was and sometimes it wasn't. It was good if you got the right medicine, obviously. But there wasn't really much diagnosis going on here. Who was the other person you could go to? You could go to a surgeon. You'd think, well, didn't they get trained in the universities? No. It's only physicians, because surgeons are seen as being very close to people who work with their hands. They don't go near universities. They learn a trade by being an apprentice, by following a master surgeon around. Here's somebody doing a minor surgical procedure on somebody's leg, probably an ulcer or something like that. Surgery is not a massive discipline in this period, mainly because it's extremely dangerous, and they still know that. However, having said that, just to finish this lecture, I'm going to talk very briefly about a surgeon who's a famous one and why he's famous. He lives at the same time as Vesalius, but he's French, and he's referred to as a surgeon of the long robe. I'm sorry, he should have an acute accent on his name there, Pare. My computer wouldn't do an acute thing. Who's he and why is he so well known, and why are we still talking about him today? Well, there he is, a not very flattering picture of him, as you can see. He lived in France. He was a French speaker. He wasn't educated, particularly. He certainly hadn't been, he may have been to school. He certainly hadn't been to university. Nevertheless, he was called a surgeon of the long robe. Remember what long robes mean? Means you're educated. So he had been to a college. In France, by this period, they'd actually set up a college. You can read about it if you want to online. So he'd got a little bit of education there. So he was seen as an educated man, albeit not a university one. Here's a picture, obviously from a much later period, of Pare. There he is there, with all his wounded soldiers during one of the wars. Okay, what gave him the edge? Why was he somebody who changed things and somebody who's still famous today? Well, he had the good or the bad luck, depending on the way you look on it, to live in the middle of constant warfare. Not unlike we have in some parts of the world today, unfortunately. France, in the 16th century, everybody was fighting everybody else. Very hard to work out why. Not totally dissimilar to today either. But it was nasty. They were all fighting each other, and the civilian population was caught up in the whole thing. So, ironically, and it's still the same today, exactly the same today, if you're a surgeon, of course you don't want wars to happen. But you get fantastic experience if it does. And everybody knows that big strides in surgery are made in wartime. Not good, but on the other hand, a long-term benefit, perhaps. This one particularly was the case because in the 16th century there was a lot of new technology being used in war. We might not be particularly impressed by it, given what we have these days. But nevertheless, when you consider that before people were shooting at each other with arrows and clunking each other on the head with big hammers and things, it was actually quite sophisticated. And I'll show you a picture in a minute what some of the technologies were. Also, battlefield experience as a surgeon. Here's a later picture supposed to show Pare doing some battlefield surgery. It's done under, still nowadays, even with our sophisticated surgery, it's still done under extreme conditions. You just need to watch the news at night to see that that's the case. So from the point of view of the surgeon and the people helping, they'll make much more drastic decisions than they would ever make actually in an operating theatre up the road in Prince of Wales or somewhere. Because it's usually a case of being done under fire, never knowing when you're going to be blown up anyway. Highly unlikely that the patient will survive unless you do something pretty drastic. So new procedures are very often done under cases like this because otherwise the patient would probably die anyway. Here's some of the new technology of the 16th century. Guns. This was the big cutting-edge technology of this period, rather weird-looking ones, as you can see. Here's one called a musket, all with long barrels, as you can see, and this one was an arquebus, even longer barrel. Certainly pretty scary, there's no doubt about it, if you were at the other end of one of these. But two things about it. One was guns right until the 19th century, and for all I know, in some cases even today, were often more dangerous to the person who was firing them than the person who was being fired at. Because often they weren't very accurate, and they often had a huge kickback. So these blokes who are standing there were far more likely to be injured than the people that they were actually trying to fire at. But the other thing was it sent explosive-driven projectiles out of the gun. And that was new. If it did hit somebody, that was a new kind of wound. Never had wounds like that before. So because of the shot that came out, the wounds were messy, infected, and they were also burns. Quite different from being hit or shot with an arrow. So what did Pare do? Well, along with his fellow surgeons, he thought this was the time to think of some new instruments and procedures. Up until this period, and here's a picture, what did you do about blood loss on the battlefield, for example? Well, they had a very odd procedure that if you see a picture like this, it often gets mistaken for torture. And actually, it's not torture, it's the doctor doing some healing, the surgeon doing some healing. You see what he's got in his hand? He's got a thing that looks like an iron with a long handle for a reason, obviously. And here he's got a brazier full of hot coals. So this bloke here isn't being tortured, he's actually being treated. He gets, the surgeon here, gets his bit of iron on his long pole, puts it in the hot coals, and puts it on the wound. Not in order to hurt the person even more, but the theory is it's a cure for blood loss. It stops the bleeding. Well, it often kills them as well, of course, so I suppose that does stop the bleeding. It was a pretty drastic way of doing it. It was also done for infection. If you had, nasty pus and stuff like that coming out of a wound, the cautery, that was what it was called, the cautery. That was what you used, and basically that was all there was. Hippocratic medicine hadn't said much about wounds. Galen said a bit, but he went with the cautery, basically. So you got masses and masses. Here you can see from a textbook all of these different cauteries and the fire there. So this is actually a textbook. This is what you use. Pare says, well, quite frankly, I don't know about that. I think I'm actually just making people worse by doing this kind of thing. Because actually what he'd got onto was the notion of shock, which is something we're obviously familiar with today. You put a hot cautery on somebody, of course they're going to be shocked. There must be better ways of doing this, thinks Pare. So he has a go. It's wartime. What harm can you do? Instead of using the cautery, he suggests that the surgeons use a soothing ointment. Now, this is where we have to wonder a little bit about how he reports this. Just like nowadays, even in academic papers, people don't always report things accurately. He reports that he makes up a soothing ointment of, what is it? Oil of something or other, egg yolks, and something and something. And you have to think, well, where did he get that on a battlefield? Quite frankly, that sounds a little bit unlikely. So he may have just put things together to make a better story, perhaps. Nevertheless, this is what he reports. And he reports it in a book. He writes a book. This is very, very unusual. Surgeons don't write books, and they certainly don't come up with new approaches to healing. They just do the old stuff that they've been told by their masters when they were apprentices. So he writes in French, which is even more unusual, not Latin or Greek, what he calls his apology and treatise. And he explains in it his new versions of treating wounds. You're probably sitting there thinking, well, this isn't at all unusual, but it was. And he also said in his book, I dressed him, his patient, and God healed him. So he's coming back a little bit to the notion that he's not on his own here. He's got some help from God. That was the kind of thing, remember, that the Hippocratics didn't want to have anything to do with? But now, in the 16th century, the church likes this sort of thing. So they like Pare saying that. They like the idea that the surgeon isn't simply on his own, that he's actually got help from God in healing this person. Did soldiers on the battlefield actually survive longer? Well, these days, of course, we would do a controlled trial to work out whether more soldiers survived having had the cautery or having had the soothing ointment. We really have no idea. But certainly, he was putting forward new ideas and new treatments. So, for the next 200 years, which is quite a long time, Pare becomes what you might call the poster boy for rational, professional, educated surgeons. The surgeons are stopping being men, they're nearly all men, who just use their hands, who do things the way everybody's always done them, who follow a master around and learn on the job. They're actually claiming to think, how do I treat this patient? How can I treat them better? What can I do about that? And also, how can I write it down for the benefit of other people who would like to know how my treatments go? I can't stress enough how unusual that really was in this period, which is why we're still talking about him at this period, of course. So there's two new moves. There's Vesalius doing his anatomy himself and putting out an illustrated book on it, and giving the students a small book that they can take with them and put their notes in the margin. And there's Pare, who's written a book, who's given aspiring surgeons the idea that they can actually treat patients in a new way, a different way. They can use their brains. They just don't need to go the same way as everybody's gone for years and years and years. Well, you might say, why didn't they get together? Wouldn't it have been useful for the surgeons to be able to watch all that anatomy, to actually get an idea of the structure of the body as they were actually going to be doing stuff on it? Did they? No. Not until the 19th century did surgery actually go into a university. Until then, it was still more or less learning on the job. And the reason for this, and this is an issue that will come up again and again, was basically professional jealousy. It happens, unfortunately, in professions. The physicians who'd been for years and years and years to university, as you may well do, were very jealous of their medical degrees. They said things exactly like students say these days who graduated with a degree from medicine. Look, I did 7 years, and now I've got to do another 7 years, and I'll be goodness knows how old before I actually earn any money. Why should we let these surgeons in, and why should they be taking their business from us? We want them to be under us, which is, of course, a system we still, to a certain extent, have today. We want to be able to refer our patients to the surgeons. We don't want these surgeons just getting patients on their own. So there's a huge sort of professional standoff between physicians and surgeons, which unfortunately, for the patients, does absolutely no good at all. From their point of view, it would be much better if there'd been a lot of collaboration here. The apothecaries, meanwhile, are still selling their medicines in the shops for people who can't afford either the physicians or the surgeons. So this tripartite thing that we still have these days, notice, physicians, surgeons, and not apothecaries, obviously, but pharmacists. And we're still having this kind of thing. It's shifting, but it's still there. Could we have nurse practitioners who are actually almost like physicians? Could we have generalist physicians who also do a bit of surgery? What about pharmacists? Why can't you go into your local pharmacist and tell them what's the matter with you and get a diagnosis and maybe even a little bit of treatment? And the reason for not doing any of this stuff is not necessarily that it's not a good idea. It's often to do with, like, maintaining your territory, unfortunately. So this will come up again and again in future lectures. Next week, just let me tell you what we're going to be talking about. I'm going to talk a little bit about when medical science was called natural philosophy. And we're also going to talk a little bit about who the witches were, and also helpful test hints and your chance to ask questions. So please tell your friends, if you want to ask questions next week, please come along. And not next week, the week after. See you then. Yes, I wouldn't ask you anything that wasn't like that. Yes, nice. Well, why don't you bring that up next week when you come, and we can talk about that, about what kind of, well, I will talk about exactly what kind of questions there are.
When I look at this, I can not take a note.
No, that's right. You don't actually need to take notes, really. It's enough that if you can listen over again on the audio, and you can also read these, because they're both up on Moodle. So it's probably better doing that in a way than trying to take notes. Because I won't ask you anything that I haven't said here. Yes, that should be enough. Yeah, but I'll talk about it in the week after. Okay?